Okay, so we talked about the compression to the sciatic nerve. So you can have compression at any nerve that would cause this. It could be in the arm. It could be other places. It would not be sciatica, because the sciatic nerve are the nerves that come out from the lumbar spine. And so the sciatic nerve, there's 5 different branches that come out. They all coalesce. They go through the middle of the buttocks here. There's a deep muscle called the piriformis muscle that nerve passes through on the way to the leg. If that muscle is contracted chronically, then you can get an irritation of the nerve, and so you can have sciatic pain just from that muscle down here being tight. It doesn't have to be from the back. It doesn't have to be the nerve root. It can be from that muscle, or it can be both. It can come from various places. So a proper diagnosis will actually say, okay, is it coming from here? Is it coming from here? Is it this structure? Is it this twisting? Is it that twisting? Is it the muscle just being tight? It may not actually be a nerve involved at all. It could be just a muscle seized up, and then that will cause pain.
That sounds like pretty much what I had done instantly, but stupid, I guess. Sitting on the
well, you were just
with my legs crossed, and then leaning over like that. I was would have compressed. Understand that I would have stretched and compressed the muscles, and if a nerve was passing through it, that would. Or
if the muscle just got tight, then it can bind up,
and
then you can get the pain from that. So, according to the Academy of Orthopedic Surgeons, sciatica is most likely to occur around ages 30 to 50, and about 80 to 90% of people get better without surgery. So most people don't necessarily have to go in for surgery for these problems. Another cause of back pain is the bulging of a disc. So first we talked about impingement or a constriction of the nerve. So another cause is bulging of discs. In between each of the hard bony vertebrae, we have like a little shock absorber. It's like a tiny little tire. Anyone ever had a flat tire? And do you know that green goop stuff that you can? There are these cans and things you shake up and you turn it in and it sprays a goop inside, right? And it helps to seal off the thing. So if you imagine a small tire with all the treads around it and filled with that green goop, that's sort of what our discs are like. Now, if you leave a tire, if you let the sun beat down on a tire year after year after year, what's going to happen to it?
It's going to
It's going to rot, exactly. And so the fibers are going to break down. And so if it's filled with that green goop, the green goop might start to ooze out through the fibers. And that's what can happen in the vertebral discs as well. Over time, they can weaken because they've been pounded on, or you've been doing the hoochie-coochie. I don't know, you're dancing and you're jumping up and down a lot, or trampoline, or maybe your job is you're using a pneumatic drill or something. So over time, you can have this weakening of the fibers, and then the fibers will start to allow the inside goop to sort of push out. Now, in my car, over the years, I bought like retreads. Anyone ever bought a retread tire?
Oh, yeah. A long time ago. I don't see them anymore.
It's hard to get them, but a retread tire, they put this extra layer of fiber on the outside, but the inside core has already worn down a little because it's been run a long time. So sometimes on a wheel, I've had tires where there's a little bulge come out, and as I'm driving down the road, the steering wheel starts going, like that. It's because there's a bulge sticking out. And so that's what a disc bulge is. That's where the fibers get a little weak, and the inside pressure can push out and just create a little knob on it.
It's like a hernia.
Exactly. And so a herniated disc is a bulge. So there are different degrees that this can occur. So it could just be like a little bump on it, or it could be bumped really far, or it could actually break and the goop on the inside could start to come out. And because it's totally surrounded by other tissues, the bulge will tend to go where there's nothing holding it back, and that's where the nerve roots come out. And so that's why a disc bulge may or may not have any influence on back pain. It may not have any influence. We do x-rays. X-rays are done all the time, and people's back, you look at the x-ray and you think, that person must be in agony. No symptoms whatsoever. Other people may have a tiny little thing in their excruciating pain, so Just because you have a disc bulge doesn't mean that you're going to have symptoms from it. Our body is very wise in the fact that the space where the nerve root comes out is probably the proportions, at least like my finger and this hole. There's a lot of extra space in there, right? So nature built in a safety network. So even if there's a little bulge quotient here into that hole, the nerve has a chance to move a little out of the way. It's not necessarily going to be compressed. It might rub against it sort of like a little friction burn. You might get some sensations that way. But a disc bulge is not necessarily always going to cause pressure. So here on this slide we can see this is the normal goop inside the tire. This is the pressure with the little knob coming off the edge. Where this is weakened, the fibers have weakened a little bit, and so the goop, as pressure is applied on it, will start to push out through the fibers. So that's a little bit of a bulge. This is a herniation, where actually the goop actually sticks all the way out through the fibers. All right, so that's herniation. And then sometimes that goop can get broken off, and it can start floating around inside.
That sounds like
that's worse, you know. But if someone's in a really bad car accident or something where their car flips over 5 times, you know, the jaws of death have to, like, jaws of life, not jaws of death. The jaws of life have to open up the car, and they're, you know, totally out. That's when you can have this severe impact of torquing around, where this kind of herniation and other things can, like, come out. Or injuries. There's a patient of mine I've seen for many years who was working on top of a large refrigerator, and he fell off of it, and so it messed up his back and his leg and everything, and that's like 25 years ago, this industrial injury, and because it was filed at the time, he's still able to get treatment for that injury. But that was like really messed up.